What's the first thing? Load clips. Okay, here is a clip applier, right? Mm-hmm. That's the end clip. You get the matching colors, usually. You have older stuff, but so when you load a clip applier, the way I do it is I hold it here, and I'll tell you why. Any pressure on this at all, you're going to crimp the clip, and it's going to fall out before you hand it to them. You know, people do it all the time, but I always hold it this way or this way, so I don't hold it this way. I'm not that good. You know, I can accidentally put pressure on it and not even know it. And I figured that out by doing it wrong. I mean, by always dropping clips. Why am I dropping clips? So, push it down, pull it up. See how tiny that little clip is? Yeah. You can pass it around like that, so. So on these bigger ones, a lot of times when you stick your clip applier in there, sometimes the edge is sticking out. See how that fell out? Mm-hmm. I'm trying to do it where the edge will stick out without it falling off. Okay, see that? How it's sticking out? Mm-hmm. You guys all see that? Mm-hmm. The edge is sticking out? Yeah. So a lot of times I got in the habit of doing that on my mail before I handed it to them. Because you can go in and you can accidentally tear a vessel. It doesn't always stick out that much. I was exaggerating the fact so you guys could see it because it's so small. That's not required to do that. That's just something I do. A lot of people, when they do that, like you guys starting out, you'll accidentally push on it and it'll fall out. So you're not required to do that. So you just push it in, pull it out. If you push it hard enough, it's going to be right on the line, usually. But, so... Y'all understand how to do that?
So you want to push it hard when you're pushing. You
want to push it hard. That's why I don't hold it this way, because if I push it hard this way, I'm going to accidentally squeeze a little bit. I just can't help myself but do that. It just happens. And then I pick it up and it drops out, and then I pick it up and it drops out. So, everybody understand how to load those?
Yes.
Okay, tie on a passer. Y'all know what a tie on a passer is? That's a free tie on a passer, a tonsil. Is this. How you load it is you have your free tie. Put the end in.
Okay, so it's just
it's a free tie on a tonsil.
Okay.
It gives you something to pass it with. This is a passer. When we go to that table, when I show you how to pass instruments, I'll show you the different ways of passing this. But this is loading. So, we all get how to load them.
When you say passer, is it always tonsils?
Usually, yeah.
Okay.
Some surgeons will say on a hemostat or something, but the reason why we do it on a tonsil is because see how little the end is, and then the tonsil end is really fine tipped compared to like a Kelly or a Cochran where they slide through. So a tie on a passer would be a free tie. And when I'm done showing you guys all this, you get to play with it. I'm gonna go with each of you and help you guys figure out how to do this. Okay, what's the next thing on the list?
Sponge stick.
Okay, so these are our sponge sticks, and I've loaded them up 3 different ways. They're all correct. There's all different ways to load them. So when you're doing a vag prep, you got to fold 5 of these together. So this is usually the easiest way to do it. You fold it over once, twice, in half. And you put it here because you're going to do 5 of them, and you need your hands free to fold them. Then you stick it in a med cup. So here is one way to load it. Another way to load it is fold it just in thirds again, like this. Some people like it this way. You open it up, put your ends in, clamp down. This is used for pushing tissue back or swabbing tissue up. One more way. This is what they call the diaper. Like 3. Fold it in a triangle like a diaper. Yep. This way. This way. Clamp it down. There you go. You got that? Any questions on that?
You say some people like, is it surgeons like, or surgeons don't care, scrubs are just doing it whatever?
Usually it's a scrub's preference.
Okay.
A lot of times the reason we do that, you'll always see this style when you're doing a vag prep. Because
Okay.
you have to hold them and put them in a cup. So you do a vag prep, you open it, and you got to be able to drop it in a container.
And then
and
grab
pick your next
another.
one up. So that's why this method of folding your sponge is
Works for
used
that, okay.
vag preps. Some people just always use this method. It's a scrub's choice. But you will always use that method for vag prep because you can't do this.
Right.
This is more for during intraoperative phases. Okay, loading needles from individual packages or multi-packs. This is a multi-pack. Why? Because it has multiple sutures. Pretty easy. This is a single pack. This is a double-edged one. See 2 needles in there? If you have really good eyes, you can see from this distance. So what it is it's got a strand of suture, and it's got a needle on each end. That's used for a lot of vascular cases. So if you load that and pull it out, there's going to be a needle on the other end. Don't forget about it. So to load these, the first thing you want to do is pick the appropriate needle driver for the needle size you're going to use. So if I was going to use, see how little those needles are? Everybody see how little those are? Okay, so if I was going to use these itty bitty needles, what I want, like a needle driver this big, right? You'd want this one. You want the smallest, the one that fits the needle the best. So if you have these bigger ones, then you wouldn't want to use this itty bitty one or this itty bitty one. Make sense? Okay, so we're going to use this one. I'm going to show you how to do it. I have a peel pack. This line here is kind of my cheat line. I'll bring my needle holder in, load it, and it's already on in the right angle and everything for the surgeon. Because you don't want to sit here and have to touch a needle with your fingers and mess it. You know what I'm saying? That's not good. Can you see back there?
I can.
Good.
And where did you clip it? Did you clip it on this end?
Yeah.
Okay.
So if you look at the suture, even if you have no clue, if you look at the suture and say, okay, that's the pointy end,
Yeah.
I'm not going to want to grab there. Because, you know, we give you a lot of information fast, and I understand it's hard to not only remember it all, but to keep it all right, not mix sentences of this and that together. You know what I'm saying? We get that. We understand. Just ask us. We'll show it to you.
How will you do it?
Okay. So I'm going to put my needle driver in there. Okay.
And does it matter which end you're taking from?
What do you mean?
The right or the left?
I don't understand what
Well, you're
saying.
holding it. Well, do you take this needle first or that needle
Okay, that
first?
doesn't matter.
Okay.
It's numbered right here, but we don't look at that. You guys will learn in counting when we count our instruments. We'll count. You'll see everybody use their fingers. You know, you're not supposed to. You'll count 1, 2, 3, or 1, 2, 3. It doesn't matter which side you go from.
Okay.
It's just a extra counting device. So if I see there's 8 there, but there's 1 missing, then this is a defective package. The count will be off. Get rid of it. You'll learn all that later.
Okay.
But no, it does not matter which end you grab from.
Okay. Didn't know if it like tangled up sutures or.
No, it won't. It's all labyrinth in there. Reties can sometimes tangle up once you get them on your mix. Okay, so this needle holder is itty bitty. See that? When you load this, you push your fingers down, it locks automatically. To unload it, you just push it again and it opens up. This is usually for vascular stuff. And you use itty bitty needles. Like that. So you can barely see that thread.
Wow.
They use these on vascular surgery a lot. This one is magnetized, so it's a real pain. Okay, everybody got that down?
And that's the one with the 2 needles on both ends.
No, that'd be this one. And you'll learn in suture what everything on the package means. Like if you see that has 2 needles, that's telling you it's a double swedged on needle. I don't want to confuse you by telling you what everything means, because you'll learn that in suture. And you can look at it. The needles will always be visible, and the reason for that is for when you count. Before you do any surgery, you have to do a count. And if you can't see the needles, then you can't count them. You and your nurse has to both visualize the item being counted. So whatever you count, you will be able to see. Okay. Any more questions on that one?
Do we need to learn how to load the double-ended?
You load it the same way. A lot of times they'll have you cut it, meaning they'll have you pull it out. They all have little lines like right there. And these ones you can just look because they're big enough. So you pull it out, and if they want you to, you stick a tag on that one, or a mosquito on that one or something.
So both ends don't go in a needle holder. Forgive me, both needles don't
Correct.
go into...
Both don't go in at the same time. They do this because they're going to, like, suture here, and then it's attached. Like this is a vessel. They'll let go of that end and put a tag on it. And then they'll grab this end. And so they're doing it from both sides. That's one of the reasons they would use this. But again, the answer would be no, you do not grab them both at the same time. And these are so little, I'm going to stick them in the magnet for now. Okay, any more questions about needles and how to load them? And you guys all get to do this. You get to play with it all in practice. We don't expect you to just watch me and know how to do it. All this stuff takes practice.
Back on the blades, because we did go over that, but the one thing that Ms. Eason had said that she forgot to show us was how to use an unloader that's built into the tray.
I never use them. Nobody ever uses them, but I know you guys have to be shown it. And I think she's going to show you how. I don't think that's the proper one to show you. It's a different kind of needle box. She probably didn't show you because she probably didn't have the proper needle box with her. Because we have several different ones in the cabinet.
Okay.
Let's see. I'll try to find one when we're done. You guys are playing with this stuff. Okay, where are we at now? Free needles. Anybody have a clue what a free needle is?
It's not in a package.
Well, it's in a package. Everything's in a package.
Doesn't have suture.
Correct. There's no suture. It's not swedged on. These are free needles. There's 2 ways free needles. Did she already show you this?
Absolutely.
You showed us one.
One way.
To up, around, and
The locking. Yeah, that's right. She told me she showed you the locking. This is the unlocking. You just thread it through. I don't know very many surgeons that use the unlocking, or even free needles for that matter, but some do. This is going to be really funny because I'm going to show you what you guys are going to do during your checkup. Every student does it. Don't feel bad. It's just what's going to happen. Your hands are going to go like this. That's normal. We all did it.
Can you stop the timer while my hands
No, can't do that. So you just pull it through, and you have it come down like 1/3 of the way. Anybody guess why we don't pull it all the way down?
Because they still need to use it.
Well, if you take the thickness of this and you double it, that's the size of the hole you're making. So you're making a bigger hole than necessary. So you want it long enough to where it's not going to fall off as you're handing it to the surgeon. I don't know why I always say him. They're not all guys. But you also don't want to make a hole bigger than necessary. So that's the freeway. Not the highway. No, I'm kidding. This is the locking. And she already showed you that, right? You just go around, do the middle, right? Okay. How many sure you got? What else is on there? Okay. I don't think this is a Haney, and I'll tell you why, but we're going to pretend it is. The Haney usually has a ridge through it. used in a lot of gynecological cases. This one doesn't have that little ridge through here. If you look on there, yeah. If you look on that board, you'll maybe be able to see what I'm talking about. But it's still the same shape, so we're going to pretend it is just so I can show you how to load it. The curve always goes away, which is backwards than anything else. So, you load it with the curve pointing away.
Okay. I will watch this later and make all my notes.
So it's backwards, basically. Yeah, it's the opposite. The needle is pointing in the opposite.
Towards us, it's pointing that way.
Right. Opposite of the curve. All you gotta know is the curve goes that way, the needle goes that way.
Mm-hmm.
On a handy.
Not like that, right? And that's only what about other curves?
Not very many people use the curved ones, and they'll use a handy. The only other time a needle will go in the opposite direction on a straight or curve would be for a left-hand surgeon. We'll show you that later, how to do that later. You just flip the needle over. So I can show you now. Here's the straight one. Okay, so Dr. Birch is left-handed.
Which one? The girl or the guy?
The girl. Okay. So, I'm going to hand her the suture. This is the normal way, right? When you put, so that's the doctor. You're going to pass it. You're going to pass it. The point, think about stabbing him in the heart. That's how you remember. For a left-hand surgeon, all you do is flip the needle over. Like that. Does that make sense? Because you're passing it to the left hand. Easy cheesy. We don't want you guys touching needles with your hands. You're not supposed to do that because I'm putting them back in the package, which would never happen in the real world. I'm touching them with my hand.
Actually, we were told in class that we were allowed to adjust our needles with our hands.
Okay. You don't want to put them in a package like that because you're going to get stuck. When I was in here trying to put stuff together, I accidentally stick myself because it's not meant to be put back together. It's used and gotten rid of in the sharps. That's all I was trying to say. Your needle boards, when you're taking suture back, or you're taking the needle back, always line up your boards. I mean, put your needles, and I demonstrated, 1, 2, 3, 4, 5. Put them in like that because when you go to count, if your needles are everywhere and there's suture hanging all off them, because there will be, you can get really confused with your count. And the count's going to be hard for you guys to get down in the beginning. It takes a while to learn how to count all your instruments, your sharps, your sponges. This will make counting so much easier on you. So that's why they're numbered in little spots for you to put them there. If you have a big giant needle like this, if I get one of those in my case, I stick both points down right there, and I can tell that that's one item. Because it'll stick way out here, and you'll end up hitting your hand on it when you're reaching or going to put another needle in there, and you'll end up poking yourself or tearing your gloves, or something like that.
Once you've put a needle in a needle board, you're never going to use that needle again, right?
Usually, no. But sometimes a surgeon will hand you a suture back, and it still has a bunch of suture on it, and he'll say, "Oh, to save expense on the patient, instead of opening up a brand new suture when he only needs a little piece, and there's a bunch in there, he'll ask for one of those."
Okay, but that doesn't make it. It doesn't.
It's sterile. It's on your sterile.
Well, no, actually, I was thinking the dulling. You know.
Well, on a brand new sponge, this is a lot easier to penetrate than their skin.
Okay.
So, and they're asleep. They don't feel it. Trust me. They don't feel it. They're going to feel the hurt from the surgery more than they're going to feel a little poke from a needle. Okay. Anything else on that one? Okay, so let's go over the hand signals. A lot of times the doctor, or even when we're playing surgeon and you guys are our scrubs, will not ask for something. We'll use hand signals, and a lot of doctors will too. So, the hand signal for a clamp, they want you to hand a clamp to them, they're going to go like this. So, ask for a clamp. Like You're left-handed?
I'm
I
not
put it like that.
left-handed, but sorry. I'm just faced this way.
Or you just stand like you're doing surgery.
Oh, like this. Okay.
Yep. I'm gonna put it, pop it right in their hand. Does that make sense?
Mm-hmm.
Okay, so if they go like this, they want a clamp. This is not a clamp, but a stick.
Don't mind any wrongs.
If they want a stitch, they're gonna go like this. If they want a stitch, they're gonna go like this. They make the motion of passing suture through skin. So this is a stitch. Everybody do stitch. Right? Okay. If they want pickups, think about pinching your finger and your thumb together. And the reason why, I'll show you when we get over to passing, because it's all over there. I can't show you from this table. The next thing is a tie. They'll go like this, and they'll go like this. Let's move this table so I can show you this.